All right, we will go ahead and get started. Good evening, everybody. Thank you all so much for joining us this evening, and happy World Sight Day. We are very excited to have you all this evening for our webinar on thyroid eye disease, Can I Talk About My Eyes?, hosted by the Vision Health Advocacy Coalition and Prevent Blindness. My name is Olivia Perry, and I serve as the Coalition Director for the Vision Health Advocacy Coalition. So thank you again all so much for joining us this evening. A brief overview of our agenda for this evening. As you'll see, we've got a few great educational videos that we'll be showing throughout the presentation. You will hear from Prevent Blindness as well as our clinician perspective and our patient experience. As you'll see at the end of the webinar, we do have some time for Q&A. So if you do have questions, please submit those through the Q&A feature on Zoom. You should see that on your kind of selection bar there on your Zoom screen. So please feel free to submit questions throughout the webinar, and we will get to those at the end. So we will kick things off here with our first video of the evening, which is thyroid eye disease. Did you know?
Did you know? Thyroid eye disease is brought to you by Prevent Blindness and the Vision Health Advocacy Coalition. Thyroid eye disease, TED, is sometimes called Graves' ophthalmopathy or Graves' eye disease. Graves' disease is named after Robert James Graves, an Irish surgeon born in 1796. Graves' disease usually causes an overactive thyroid gland, hyperthyroidism, and up to 50% of people with Graves' disease develop TED. However, TED can also occur with normal thyroid hormone levels or low levels of thyroid hormones, hypothyroidism. TED is an autoimmune disease in which the immune system causes inflammation and swelling and leads to abnormalities within muscle, tissue, and fat behind the eye. Because of the inflammation and swelling, the eyeballs begin to bulge out. Called proptosis. The eyelids may not close properly when blinking and sleeping, which can lead to the front part of the eye, called the cornea, becoming unprotected, dry, and damaged. Stiffening and inflammation of the muscles of the eye may lead to double vision and, in severe cases, compression of the optic nerve, the nerve that connects the eye to the brain, causing vision loss. Smoking increases the risk of thyroid eye disease by 7 to 8 times, causes TED to have a longer, active phase, and it reduces the effectiveness of treatments. Symptoms of TED include dry, gritty and irritated eyes, red eyes, watery eyes, puffy eyelids, sensitivity to light, and bulging eyes and lid retraction, giving a staring or startled appearance. TED is managed by an ophthalmologist and an oculoplastic surgeon. Any underlying thyroid problems will be managed by your primary care doctor, PCP, or by a specialist in the hormone systems of the body called an endocrinologist. Treatments for TED include cool compresses, eye drops, steroids, and surgery. There is an intravenous infusion treatment that is the first FDA-approved medication for the treatment of thyroid eye disease. Now you know all about thyroid eye disease. For more information, visit preventblindness.org and visionhealthadvocacy.org. And of course, schedule an appointment with your eye doctor. Thank you.
Wonderful. Well, a great way to kick off our webinar this evening. As I mentioned earlier, my name is Olivia Perry, and I serve as the Coalition Director for the Vision Health Advocacy Coalition. So just to provide a brief overview of VHAC, is how we like to call ourselves, but the Vision Health Advocacy Coalition really works to promote patient-centered policies that can make services, devices, and life-changing treatments more accessible for those with vision conditions. And really an important part of the work that we do is our incredible members. And so as you'll see on the screen here, we work with members from across the vision space, both advocacy and clinician organizations, as well as patient organizations, really in an effort to bring the vision community together on a lot of these issues, working on issues of access and education and awareness. So I'll show our social media handles here as well. You'll see our website, our Facebook page, and our Twitter/X page as well. So we'll have quite a few educational resources, events, videos. Please feel free to take a look at all of those. We have quite a few great resources. So I will hand it over to my colleague Nita from Prevent Blindness.
Thank you, Olivia, and happy World Sight Day to everyone. My name is Nita Sinha, and I'm the Senior Director of Public Health at Prevent Blindness. Next slide, please. Just to give you a little bit of overview about Prevent Blindness, we're an organization that's over 100 years old. Our mission is to prevent blindness and preserve sight. We do this by educating the public, advocating for equitable access to quality eye care, promoting the early detection of vision problems, and supporting patients and their care partners. Next slide, please. And I just want to take a few moments to share some thyroid eye disease resources that we have. Prevent Blindness has a page, a web page dedicated to TED. On that web page, we also have downloadable fact sheets that are available in English and Spanish. We also have a couple videos as part of our Focus on Eye Health Expert series called TED and Mental Wellness, and the other one is TED and the TED Community. We have a unique program called the Aspect Patient Engagement Program. This is for individuals who are who have vision impairment or are blind or their allies to join to learn how to tell their story and to use that story to advocate for vision and eye health at the individual, local, state, and federal level. We also have this great resource called Living Well with Low Vision. And this resource really provides tips and tools and resources available to those who have lost some vision. That's available for individuals, but there's sections for caregivers and also for healthcare providers. And lastly, I want to share that we have our Prevent Blindness website. It's called preventblindness.org. That encompasses all the resources that I just shared. And all these links will be shared in the post-event email, so no worries about trying to figure out where all this is found. And the last thing I wanted to mention is that Prevent Blindness will recognize Thyroid Eye Disease Awareness Week from November 10th to the 16th. So I encourage you to follow Prevent Blindness on social media and learn about what's happening that week. And next slide, please. And here's my contact information, and I will now pass it over to Dr. Kachikian, who will talk a little bit more.
All right. I wanted to say thank you so much for having me on. I always look forward to educating people. It's kind of how I got interested in this. So with that in mind, let's see if I can give you a little bit more insight about this disease. Next. So what is an endocrinologist? I always tell people you don't always need to know what an endocrinologist is because you'll find me. But an endocrinologist is somebody who studies hormones that are put into the bloodstream. I like it because it's very big picture. We do everything from diabetes to thyroid to certain kinds of cancers to women who make too much testosterone, men who don't make enough testosterone, adrenal problems, and how infertility is part of it. But today we're going to focus on the thyroid a little bit. Next slide. So why is an endocrinologist talking to you about the eyes? So as a part of some of the diseases I treat, let's say diabetes, for example, it's very important because I always tell people, you know, we try to control your diabetes, we try to control your thyroid because we don't want you to have long-term complications. And I think that's part of it. So sometimes maybe we're like a central person who's helping you make sure that you get all the different doctors you need. So for example, if you have diabetes and it's not well controlled, apart from having fluid rush to the front of your eyes, it can also cause damage in the back of the eye. So we always tell people, hey, guess what? You need to make sure you see your eye doctor once a year. Well, that's kind of how the story kind of came about with the thyroid. So with thyroid, and we'll talk about this a little bit, certain thyroid conditions can cause problems with the eyes. Like they told you previously, it was called Graves' ophthalmopathy, but now the updated term is thyroid eye disease, or if you want to be slang cool, it's called TED. But it's such an important topic, and it's so important to educate patients about it that the American Thyroid Association, this whole association for just the thyroid, actually stated in 2023 that as part of my job, especially for people who have certain thyroid conditions like Graves' disease or autoimmune thyroid disease, I should make sure that I talk to them about their eyes. Next slide. So then what is thyroid eye disease? Thyroid eye disease is a rare autoimmune condition where your body makes antibodies, which means the immune signal kind of gets goofed up in the way, and it attacks the your eyes, and it affects the muscles in the back of the eyes, the fat in the back of the eyes, and the tissue in the back of the eyes. And unfortunately, thyroid eye disease is a progressive disease. And I always tell people it's kind of like this up and down curve where it can flare and then it can get better and then it can flare and it can get better. There's definitely things that you can do to educate yourself and make things better. Next slide. So who is at risk for thyroid eye disease? We always say, people who have Graves' disease, and Graves' disease is the most common cause of having an overactive thyroid. But I will tell you, people who have autoimmune thyroid disease, which includes both Graves' disease and Hashimoto's, which is usually linked to hypothyroidism, can have symptoms of thyroid eye disease. Women, unfortunately, are more prone to having thyroid eye disease than men. Smoking, of course, your doctor says smoking causes everything. So we say smoking, and it's not a lie, it's true. Smoking can exacerbate symptoms of thyroid eye disease 7 to 8-fold. It's important to know and to ask patients about it because one of the treatment options for Graves' disease is treatment with radioactive iodine. It's still used by some doctors. It's falling a little bit out of favor from when I first did my training, but we now know that if somebody has symptoms of thyroid eye disease, or then radioactive iodine in up to 20% of those patients can cause a flare or make things worse. And then there are people who can be burdened by thyroid eye disease, even if they don't have a problem with their thyroid specifically, if they have a family history, because autoimmune diseases kind of travel in packs. So it's important to kind of know yourself, to know your family history, and then to have a provider who's going to advocate for you. So what are the symptoms? For those of you who suffer from thyroid eye disease, you can explain these symptoms much better than I can, but things that you should be aware of. This bulging or pushing of your eyes, it's called proptosis, and it happens because there's so much happening in the back of the eye where you have increased fat, increased muscle. And so if you can think of your eye as the fixed box, when all this stuff is happening in the back, there isn't a lot of place for your eyes to go except forward. And as it gets pushed forward, that's called proptosis. Well, when that happens, more of your eye is exposed. And that's what makes you sensitive to light. It can cause grittiness, dryness, this feeling of like redness to your eyes. It can make you feel as though your eyes are irritated or you have sand in them. You can get swelling, not only of the upper eyelids, but also of the tissue around it. And then some people will say they have headaches that they feel on the side or pain when they move their eyes from side to side. Those are some of the symptoms that you can see. Next slide. So I kind of explained, the more we know about a disease, the more we figure out how much we don't know about a disease. And that's not a bad thing. That's actually a good thing. And there was a national meeting, the American Thyroid Association meeting, that happened just about 3 weeks ago. And it's very exciting because for whatever reason, thyroid eye disease has become a very popular topic, and hopefully keep our fingers crossed. There's a lot more information coming out about it. There's a lot more research being done about it. And in that process, we will say that thyroid eye disease kind of has like two phases where it's active or it's really like affecting you. And so they say anything that happens from the time that you're first diagnosed till about 2 years or so is considered active, where you have like swelling, pain, dryness, grittiness. And then you guys can tell me, like, it kind of goes into a period where it's kind of like sleeping. It doesn't seem to bother you, or symptoms don't seem as though they progress. But for whatever reason, some of these symptoms can come back. And now patients who've had it for a longer period of time, more than 2 years, we say have chronic disease. But you could have a chronic disease patient who still has an active phase where like all of a sudden those symptoms that weren't bothering you are bothering you. And patients can have double vision. They can have worsening of their eye symptoms. So that's kind of the new way to explain things. So what do doctors do? Well, we have to have some way of trying to figure out, what's going on, what's not going on. So oftentimes you'll hear this thing called a clinical activity score. It's just a subjective way of a provider to be able to document what is going on. Different people use different nomenclature. I think it's more important to make sure that you tell your provider about the symptoms that you're having. So it's this clinical activity score is a way to measure inflammation. And you'll see here on the right, it has 7 different components. And then on top of it, you have proptosis, which is the bulging of your eyes, and decreased vision. That's also important. So I guess all I would say is if you're having dry eyes, if you're having greediness in your eyes, if you're having pain, if you notice that your eyes look bloodshot all the time, if you're wearing glasses anytime or sunglasses when you're out and about with bright lights, if you notice that your eyes are tearing all the time, which is actually a sign of dry eyes, you need to let somebody know. If you're starting to notice like pressure behind your eyes, you need to let somebody know. And obviously double vision, which as a provider, I would think if I had double vision, I would be like shouting it from the rooftops. But you guys are so tough that when you have double vision, you don't always say it. And until I have started asking my patients, they don't tell me, which I'm learning so much about it. And I don't know whether you guys have been suffering for so long and no one's been listening. And so you figure, well, what's the point to say it? But it's important to make sure that you talk to someone, and it's important to make sure you talk to someone who's going to advocate for you. So what is the goal of treatment? I guess I'll go backwards and say the goal of treatment is to make your life better, right? To improve your quality of life, to let you do the everyday things that we all do that we want to take for granted, which includes driving, which includes reading, which means being able to like go to your job, which means having autonomy, not always having to rely on someone. But the other parts of it are to reduce this inflammation and to reduce some of these physical changes. Obviously, this picture is pretty significant. Hopefully not everybody has this, but it just goes to show that, like our goal is to make your life better, and anything we can do to make your symptoms better, we can. And so the sooner we target it, the better off we are, because it's a progressive disease. So you can't make everything go back to normal, but if we start early, hopefully we can prevent things from happening. And this is, again, the same thing. I think along the journey, and who better to state it than, people who are actually suffering from it. But it's important to know that it's not just a matter of what is happening to your eyes. It's a matter of taking an emotional toll, not giving you the freedom to be able to watch TV, to read a book, to drive, having people look at you funny. I knew I had a patient who worked at an eye clinic, and kids are the best and the worst at the same time. They would say, like, why do you look so funny? Why do your eyes look like that? Well, after a while, I mean, it's not that you're not aware of it, you're aware of it, but it can take an emotional toll. So many of my patients will say that they don't have pictures of themselves because they don't want to be up, up and about. Some studies, if you look at quality of life, will say people who have thyroid eye disease have the same degree of burden and anxiety as someone who is just diagnosed with breast cancer. So I think the statistics are very empowering. I think understanding what a patient's wishes are very important. I think being able to acknowledge it, to have somebody else say like, yes, I understand what you're saying. Yes, there's things we can do, carries a lot of weight. So what are the treatment options? So what are the treatment options? So treatment options kind of depend on where you are in the disease process. If you have very mild symptoms where you just have dry eyes, if you have you look like you have a stare, then the option would be use lubricating eye drops. Don't use a ceiling fan. Maybe raise the head of your bed up so you don't have all that congestion. If you're smoking, stop smoking. And I know everybody rolls their eyes, but I'm serious, stop smoking. Some studies show in some cases that maybe selenium may be helpful, and there's some case reports on it. And then we fortunately now have one FDA-approved medication that we can give you for the treatment of thyroid eye disease. And fingers crossed, hopefully in the next couple of years, we're going to see a lot more medications that target a lot of other areas of thyroid eye disease that we'll be having come through. And then, of course, we have surgical options, and the surgeons who do treatment for thyroid eye disease are absolutely amazing and fantastic and very cool people, and they're skilled. But even they will say, you know, if a patient can prevent, if we can prevent doing surgery on them, we want to. Next slide. I think this is a conversation that you really need to have with your provider, but I think it depends on where you are in terms of severity. Steroids were a good treatment option. Every medicine has benefits and every medicine has drawbacks. As an endocrinologist, I have my own views on steroids. I think it's important to use them when you need to use them. I think we're finding out more and more that yes, it's great, and yes, it targets inflammation, but you need to be on high doses. Sometimes people can feel very hungry on it. People can gain weight from it. And then we find that as we withdraw them, sometimes those symptoms can come back because the steroids are reducing inflammation, but they're not targeting what's causing all those issues with your thyroid eye disease. Radiation is an option that we've done in the past, especially if somebody has vision-threatening eye loss. Now I think, and some people still use it, but I think we're moving away from that to some degree. And then with the advent of new medications in all areas of medicine, I think if we can find out what's causing or driving a disease process and we target that, that's important. So teprotumumab or Tepezza is the first FDA-approved medication. It's been out for about 5 years or so, and it targets a certain receptor on the eye cell that causes a lot of these symptoms to happen. And every medicine is great, and every medicine has its drawbacks. And again, this is kind of going back to what we said. Medicines are great if you need them and you need to have a conversation with your doctor specifically. Some people do great on medicines and they have a rapid improvement. Some people get the medication, do really well, and then may have a relapse in symptoms. And that's not necessarily because the medication failed. I think we're trying to figure out these autoimmune diseases are so complex. And so why do some people have a reactivation? Why do some people not? Why do some people with Graves' disease never have eye symptoms? And sometimes we just don't know the answer to all these questions. But the good news is that we're at least asking the questions. So this is, I mean, I kind of already went into this, but Tepro is the first monoclonal antibody against the IGF-1 receptor, which is found on the orbital fibroblast or on the orbital cells. It's an infusion, given in an infusion center usually. Every 3 weeks, you get a total of 8 infusions. I think it's important to state that if you and your doctor have a conversation and you decide that you are going to start the medication, then you need to commit to the medication. If people are on medications, I always try to set expectations. Some people do amazing after the first dose. Typically, people need 3 or 4 doses to start noticing an improvement. In clinical trials, whether you've had disease for a short period of time or for a longer period of time, we've noticed that patients have had improvement in a lot of different symptoms. But again, because it's a monoclonal antibody, you cannot use it if you're nursing, you can't use it if you're pregnant. If you are on the medication, you need to wait a certain period of time before you get pregnant. The medication has side effects. Most of the side effects are tolerable. In my experience with my patients, usually when they're experiencing issues from their thyroid eye disease, they're in such a bad state that the side effects, it's not that they're not there, but they feel as though the benefits of the medication outweigh the side effects. And of course, I always try to talk to them about what they can do to mitigate symptoms. If you have a history of diabetes, it can make your sugars worse. I'm sure you'll hear that there can be hearing changes. I think now that we know more about it, up to 15% of patients who have autoimmune thyroid disease can have hearing issues. So it's important to address it, and it's important to go get testing done, and then it's important to continue to talk to your doctor about what's happening. Most of the symptoms or side effects that happen from the medication dissipate after the medication is discontinued. Muscle cramps are definitely something that can happen. because it's a monoclonal antibody. Some people say that they're tired when they take it. I have some people who take it and they feel as though it's a walk in the park. There's other people who are like, yeah, I still want to do it, but like some of these side effects are pretty not fun. And then I think it's important to know that it can worsen inflammatory bowel disease. So if you start the medication and you have a change in your bowel habits, or you start having blood in your stool, that's important to talk to your doctor about. And then surgical options. I mean, I think, and I'm not a surgeon, but what I will tell you is when I work closely with the surgeons and when I work closely with my patients, surgery is amazing and the surgeons are amazing. But again, they're trying to fix the consequence of what's happening, not necessarily fixing what's causing the issue. And they will say, you know, surgery is a multi-step process. You don't just go in and do everything. You do decompression so you don't have as much bulging. And sometimes they do one eye and then you get better and then they do the other eye. And then you come in and they fix the muscles, which is called strabismus surgery. And then once all that is done, then they come in and do eyelid surgery. And people have looked amazing on it, but I think you'll hear that, you know, surgery is definitely an option. And some surgeons say, I like to use the medication first, and then I see what the medication can do. And then if I need to limit my surgery, that's what I like to do. But that's kind of the story with the surgery. So what can you do? I think you can try to see if you can find a doctor who has a passion for it, a thyroid eye disease specialist. And I know you can go online and find one. You need to work with a team of doctors, your primary care doctor, obviously, your endocrinologist, your eye specialist. And you don't necessarily need to obviously always go to an oculoplastic surgeon. Where you live, there may not be an oculoplastic surgeon. A lot of people go to their optometrist. I go to my optometrist, and then they know enough about where to direct you. I think it's important to find support groups to know that the things that you're experiencing are real. I think it's good to reduce stress, which I always like in quotes say like if you can figure out how to do that, please comment in the chat so I can also do it. Use lubricating eye drops, selenium for some people, don't smoke. And I know my patients will tell you that I always tell them if you smoke, you're going to get wrinkles and you're going to have to pay for Botox, and that's going to be expensive. So maybe just spend the money on a vacation and reduce stress, and then you don't need to smoke. And then obviously seek support. Seek support of family members, seek support of other patients, seek support of your providers, because it takes a village, right?
Well, thank you so much, Dr. Kachifi, and that really was such an informative and an incredible presentation, and we really appreciate you taking the time this evening. So I am very excited to be joined by Rhonda Lynch, who is a thyroid eye disease patient, and she's going to join us here and share a little bit about her experience. And so, Rhonda, what I'm going to have you do here is maybe if you can start off just by introducing yourself, sharing a little bit about your story and when you were diagnosed with thyroid eye disease.
Okay. Thank you for having me. It's nice to be here. And Dr. K is my hero. I just got to say that first. I have a master's degree in mental health and rehabilitation counseling. I'm a certified rehabilitation counselor. I was just a counselor for 8 years, and I've been the district supervisor for our state vocational rehabilitation for a decade or so. I supervise 8 counselors. I'm a board member of the VA Veterans Health Administration, the HR Professionals Network for the Council of State Administrators for Voc Rehab, and a local board member or a local agency that does disability services. Let's see. Let's see. Okay, I've been working with people with disabilities for about 35 years and been a mother to a person with a disability for 38 years. I have 3 grandbabies, a husband, 4 kids, and I have Ted. Ted's not one of my kids though, but I think one of the first times somebody mentioned that they thought I had some kind of eye disease was in 1995. And I had my daughter at an ENT, and he looked at me and he said, when you leave this room, you need to go to your doctor and get a blood test because you have Graves' eyes, I think is what he called it. He said, your eyes aren't right. And I went and I got tested, and the test was fine. So I'm not, I don't know if that was the first part of it. It just didn't show up on a test. And then I was diagnosed with another eye disease that's autoimmune in 2000. Let's see, when was that? I think it was about 2000. And it was called punctate interchorioretinitis. So I had a lot of steroids and chemotherapy and stuff for that. So I kind of feel like a lot of things I saw with my eyes, I didn't really know if it was that or this or that kind of thing. And then in 2013, I started getting tremors. It started in my legs and then went up to my hands. So I went to my doctor and they sent me to a neurologist. And he said I just had essential tremor. And I asked if I could be tested for my thyroid tested, because that 1995 thing was always still kind of in the back of my head. And he said, well, I can tell by looking at you, there's nothing wrong with you with your thyroid, but I'll do it if you want me to. And I said, I do want you to. And I just kept getting worse and worse. And I hadn't heard back from the neurologist. And it was almost like like a seizure almost. I was constantly tremoring. So I called him back and the nurse said, oh, just a minute. And she put the doctor on the phone and he said, I'm so sorry. I didn't look in my in basket when your test came in, but I've already called your primary doctor and you need to go there immediately. And I did, and I was in thyroid storm. And so that's when I was first diagnosed with Graves' disease. Took like I think there were 3 nurses holding my arms down trying to get a blood draw because they just were shaking so bad. And then I saw another doctor till, and I was on, I can't remember the name of the medication, but then I started seeing Dr. K in 2016. And, by that time, I didn't look in the mirror anymore, just because my eyes looked horrible. And I remember asking her, I said, Dr. K, why do my eyes look like they're popping out in photos? Because that would be the only time I'd look at myself. And she looked at me and she said, because they are popping out. I'm like, well, what is it? And she said, don't you know? And I said, no. So then that's when she explained to me what I had. And I didn't know. I didn't know till then. And she didn't know I didn't know because it was kind of like our first meeting. And then in 2017, she referred me to an ENT for a total thyroidectomy. So I did that. And then the surgery started after the thyroidectomy. Dr. K referred me to an oculoplastic surgeon. There was no Tepezza at that time. So my surgeries were I had a bunch in 2017 back to back, and then 2018, 2019. So it took a couple of years. But I had all the ones that Dr. K had on her slide. I had the bilateral decompression and the eye muscle surgery, upper eyelids, lower eyelids, fixing the upper eyelids, fixing the lower. So it just kind of went on and on. And I think I did fairly well for a while. I did notice the bulging coming back um, in the summer of 24. I think I kind of noticed it, but the only time I would notice it was in a Zoom meeting, because again, I don't look a lot. And I did mention it to my optometrist, and he said, "Well, you're just being paranoid because you had TEDs," and I knew it was, you know. And so then you don't want to say anything because you don't want to say anything. But they just kept getting worse, and by December, my eyes were so red and inflamed and hurting so bad. And I was at my primary, and I asked her to look. And I wear contacts as well with they're in under my eyes here and under my glasses. And so she looked and she said, "Well, I think you just have a contact stuck in your lower eyelid." And I said, "Why would you think that?" And she said, "Because they're blue." And I said, "Well, they're blue because of all my surgeries. That's not the contact down there." And so luckily I had an appointment with Dr. K a week later. And I was just sitting in my chair and she walked in. She said, "Oh my God, it's back, isn't it?" And I'm like, "Mm-hmm." Because she just looked at me and she knew, which is good. And immediately got me signed up for the Tepezza. And gosh, that went fast. I had a Tepezza representative, a patient advocate, and she told me, "You are going to be denied, so be prepared. This is going to be a long time. All insurance companies deny everybody." And the hospital called me a month later and said, "We have your approval. Come on in." And they scheduled me and I started. So, but I had also an MRI that Dr. K got me scheduled for. And she does all this stuff. I saw another oculoplastic surgeon who said my eyes were too damaged to do more surgery. So he also recommended the Tepezza. So all of that coordinating, and you need to go here, and then you need to go here, and you need to do, was all Dr. K. She did all of that for me. And so I did the TED, or the, what's it called? Tepezza. I got better. So.
Well, Rhonda, I just want to say thank you so much for your willingness to share your story, to share your experience, and to share your expertise, because as a patient, you really are an expert in your experience, in your lived experience here. And so we really greatly appreciate your willingness to share with us. I think, there's a couple of really important points that you touched on there. I think the first one is how, powerful of an advocate for yourself that you've been, and how much you've had to advocate for yourself in all of these spaces. I think that's such an important thing. It can be so intimidating to, to go into a clinician's office if, and have to kind of say, "Hey, actually, I would like this," or, "Hey, I have this question," and to kind of push back a little bit. And so being able to be that advocate, I think, is so powerful and so important. And then also finding your clinician advocate. So finding clinicians like Dr. Kachikian who will support you and who will help through the process, I think, is also so incredibly important, and really being a partner in that effort, right? I think that's such an important process there. And so there's a last question here that I would like to ask you, and it's
Yeah.
I think something that we'd love to leave everyone with. But for those who are kind of just starting their process or just getting their diagnosis, would you have one piece of advice or one item that you would like people to kind of keep in their mind leaving the webinar this evening?
I think to not focus on what TED's taking away from you, but it can also give you things. It can give you a sense of humor, and it can give you a different way of looking at things and make you just a better person, is how you look at it. But I think the most important thing is to make sure you have a good support system, and that have the best doctor you can find. And Dr. K can never move away. She has to stay with me here. So that, and don't give up hope. You know, when I had all those surgeries, that was the only thing available, right? And then it came back and there's something else available. So there's always something new that could be here tomorrow that's not here today.
I think that's such a powerful thing to leave everyone with. I mean, holding on to hope and holding on to strength, I think, is so important. And it's, you know, it's inspirational, and thank you again so much for your willingness to share your experience with all of us here this evening. Before we head into our question and answer here for the evening, we do have one last video to share with everybody. This is a TED Mythbusters, so a few of the things that we often see around the information and misinformation we hear about thyroid eye disease. A little bit of a myth busting there, and then we'll open it up to some Q&A from the audience.
Thyroid eye disease, or TED, is a rare autoimmune condition where the immune system attacks the muscles and tissues around the eyes. It can cause serious vision problems, but TED is often not well understood, and myths and misinformation can get in the way of care. Let's clear some of those myths up. Myth number 1, TED and Graves' disease are the same. Not true. While TED and Graves' disease are both autoimmune conditions and people often have both at the same time, they are two separate conditions. Not everyone with Graves' disease gets TED. Myth number 2, TED is just cosmetic. That is far from the truth. TED can lead to serious eye symptoms like dryness, pain, double vision, and even vision loss. Myth number 3, TED goes away once your thyroid levels are under control. Wrong again. Even if thyroid hormone levels are managed, TED can keep progressing. That's because it's driven by separate immune system activity. Myth number 4, there's nothing you can do but wait. Thankfully, that's not true. There are ways to manage TED, including lifestyle changes and innovative FDA-approved treatments and procedures. TED is real, serious, and treatable. Know the facts and talk to a specialist if you think you might have TED. Learn more at visionhealthadvocacy.org. Thyroid.
All right, well, a great way to lead us into our Q&A here. So if you do have any questions, please go ahead and submit those into the Q&A box on your screen there on Zoom, and then we will go ahead and get them answered for you. But it looks like we've got a few that are coming in already. We've got one here that says, what advice do you have for care partners in terms of how they can better support friends or family with thyroid eye disease? And maybe Dr. Kachiki and I might ask you this question first in terms of, you know, people that come in with family and friends to visit you, and maybe Rhonda, if you have any thoughts as well.
I may say the best way that you can support your family is by keeping an open mind. I think it's really great support to go with them to their appointments because oftentimes they're so overwhelmed, they're not able to listen to everything. So sometimes if they have another friend or family member who can like listen to what's going on, oftentimes they can tell them. I also think another great way to be a support system is to offer to drive or to take them to some of their doctor's appointments. What I find repeatedly is nobody wants to be a burden on anybody. And I think oftentimes we manifest that so much that we don't want to ask for help. And I think our family members want to help us because it's their way of showing that they care. So let them take care of you. You took care of them when they were little, so I guess it's only fair that they take care of you now. Yeah, I think that's the most important thing. So I'll let Rhonda answer because I think she'd probably be the best person to answer this question.
I think the best thing that you can do to support someone is just to listen. Maybe they're not always looking for you to solve the problem because you can't, but just to be able to get it out and have somebody just listen, and be supportive and not try to problem solve everything. Um, I think that's the most important thing to me.
Absolutely. Thank you both. We have another question here as well that asks about kind of additional educational or advocacy resources that exist for patients and providers. And maybe, Nita, I'll have you answer this question since I know Prevent Blindness has quite a few resources from their side.
Sure. Well, one resource that I mentioned previously is called our Aspect Patient Engagement Program. And this is a 10-week free program that folks can apply to on our website. And they'll get trained on how to tell your story in an impactful, succinct way. And that story will be used to advocate for vision and eye health in various ways. You know, yourself at the eye doctor, like Rhonda mentioned, how she was trying to advocate for herself. Also to advocate at the local, state, and federal level for, it could be for, services that are related to TED if they're covered through insurance or, other things that could be kind of advocated for. Also advocating for things, if you have vision loss, advocating for services in that way as well. So the Aspect program information will be shared, and I highly suggest that all of you look at it. And if you're interested to apply, the program starts in August every year, and there's always applications being accepted.
Thank you. I think that actually perfectly leads us into another question here from the audience. And Rhonda, I will come back to you for this one, but what advice do you have for patients who are going in and advocating for themselves? I know you talked a lot about it quite a bit in your kind of experience and your journey through this process, but do you have advice for others who are kind of going in there and might feel a little bit intimidated or unsure?
I think the key to that is having someone you trust and respect that you can ask those questions to. Even if you're getting, because there's so many people involved in your life. If you have TED or Graves, there's all kinds of doctors and so if one is saying something and it's not making sense or it makes you feel bad or things like that, don't let it drop. Talk to the one that you trust and respect, and that makes a huge difference. And that would be my advice.
Thank you. And then I think, Dr. Kachikian, a similar question from your side, but for clinicians who are advocating for their patients, what advice I think can you provide on your end for clinicians who are looking to do the same or patients that are looking for kind of a partner in this process?
I think now with all the different organizations and all the different information that's coming through, whether it's Endocrine Society, American Thyroid Association, I think I know when I first started doing this a few years ago, and I started because a patient of mine was struggling back and forth, back and forth. I think as endocrinologists, we have one of the best things about being an endocrinologist is that you get to form this long-lasting relationship with your patients. I was going to say with your friends because they do become your friends. I'm like, hi. My husband always laughs. He's like, they're not your friends. I'm like, they are my friends. I see them all the time. But I think it's important to educate yourself. I think it's important to say when you know something and when you don't know something. I think my patients will tell you sometimes if I don't know enough about it, I'll say I don't know enough about it. I think it's important to know that there's lots of resources now from all these different companies where they have medical science liaisons, whether they have other physicians like myself who are willing to talk to you, who are willing to mentor you, who are willing to educate you. So to just say you don't know, I don't know if that's okay anymore. I think you can say, I don't know, I don't treat this, but here is somebody who can help you. I think that's important. And now that it's kind of becoming standard of care, I think that it's not a new disease. It's a disease that we actually have some sort of like positive medication that is kind of altering the way the disease, moves forward. So it's good. I think it's good to educate people about it.
Well, thank you all. That puts us at about time here, but I just want to say thank you all so much to our incredible speakers this evening for sharing your expertise, for sharing your story with all of us. I want to thank all of our participants who are watching for joining us this evening. I want to wish everybody a happy World Sight Day here as we wrap up our evening, but I know we had a few questions about where you can find some of those educational resources and the videos that were shown in this evening's webinar. Those will all be made available on the VHAC and Prevent Blindness websites. And we will also be sharing some resources as well over email after this webinar. So I want to thank everyone so much for joining us this evening. I hope everybody has a wonderful rest of their evening.